As all the plants were not found in their own country, the Tibetans organized important expeditions to neighboring countries, particularly on the Indian slopes of the Himalayas. The Tibetans have no trouble recognizing the success of modern medical science. But a Swiss doctor was so convinced by the value of some of the knowledge acquired by the lamas that he immediately learnt the Tibetan language to be able to study with his colleagues from Lhasa. There is, of course, a rift between our pharmaceutical specialities, made up to the nearest milligram, and the approximation of Tibetan chemists. But after a year of observation, this Swiss doctor told me that there is no doubt about the recoveries obtained. The Tibetans have extremely precise ideas about which pills, from the hundreds available, to prescribe not only for a particular illness, but especially for a particular patient. For during my conversations with the doctors in Dharamsala, it appeared to me that they concentrated more on treating a human being as a whole than on treating the symptoms of an organic disorder. Apart from a minute examination of the eye, the diagnosis always takes into account the pulse rate, or more precisely 2 pulse rates, and observations of the reactions that occur when a urine sample is whisked, in particular the speed of the appearance and disappearance of the froth that forms upon it.